used to tell patients 1 out of 10 couples have infertility. And last year, the World Health Organization estimated that 1 out of 6 couples will have infertility.
What are some of the main myths that bother you?
In our community, a lot of people attribute miscarriages to stress. Like when we take the miscarriages and study them genetically, we do find up to 60 or 70% of them are genetically imbalanced. They were never meant to live. But most people don't know that.
How often is infertility caused by the man versus the woman?
50-50.
When they walk in, who do they think the problem is from?
90% of the people think the women.
People generally come in when it's too late.
A lot, especially in our community. Dr. Hammoud, I do it only as a last resort. It should be the first resort. You want to invest your money when the egg reserve is good. When the women get older, above 35, a good proportion of their eggs become damaged from a DNA perspective. The sperm fuse with it, then the body's saying, no, this is not a healthy egg.
What about the men's side? Like, what about sperm?
Overweight affects sperm.
How come?
So men need to produce high levels of testosterone for the sperm to be produced. Testosterone gets broken in the fat tissue into another hormone called estrogen. Another cause, they take steroids. Testosterone give a false signal to the body. So the testicle actually shut down itself. So basically the sperm count go to zero. Zero.
How long do you think couples should wait before they go into IVF?
Less than 35, you wait 35 to 40, you wait at 40, you should see the doctors immediately.
When do you know when it's time to tell the couple, stop trying?
That's a very hard conversation to say.
This is a topic that's been on my mind. I've been wanting to do this episode for such a long time because I work near an IVF clinic, and day in and day out I see people going into this clinic shameful, hiding, masks on, hoodie on. They don't want people to see them, and I always thought to myself, why is there this much shame and taboo related to this subject? So that's why Dr. Ahmad Hammoud is here today. He's going to explain to us exactly the ins and outs of IVF, why couples have infertility problems in the first place and how to combat them. Is it genetic? Is it health issues? This episode opened my mind way more than I expected it to. There's this gift of giving life that every single one of us have inside of us. We all want kids. And you can only imagine what a gut punch it is when you realize that you can't have any. I hope you have time to continue this episode till the end because this is a must listen to conversation. And while I'm here, I wanted to remind you to subscribe to the podcast, like this episode, comment, let me know what you learned, what you think, if you've had similar experiences. Thank you guys for tuning in. And with that being said, let's get the show started.
Welcome aboard Middle East
والمتوجهة إلى
طيران الشرق الأوسط يرحب
مدينة القدس العربية.
Dr. Ahmad, welcome to Not From Here. Thank you for joining us. This has been a long time coming. This is a topic that I was just telling you, it's very foreign to a lot of people. We don't understand what IVF is, what it means. I just got married. I'm not...
Inshallah, you're not going to need my help.
Inshallah, inshallah. But before we dive into all this, the way I usually start this off is self-introduction on your part. And the way I would like to self-introduce yourself isn't the typical way where you tell me what you do in your career and all this stuff. The way I like to introduce yourself is the way that you see yourself. So when you look in the mirror, who is Ahmad?
My name is Ahmad Hammoud. I am currently a physician at IVF Michigan and Ohio Fertility Centers. I was born and raised in Lebanon, and I was born in the northern part of Lebanon, in Akkar. And I spent my childhood and high school in that area. Then I moved to Beirut for medical school. I finished my medical school at a French medical school called St. Joseph University, Université Saint Joseph in French. So they teach the medical curriculum in French, actually. So it was a very interesting part of our life because, a lot of us were planning to come to the United States for subspecialization. So we had that tri-language life where among us we spoke Arabic. Our textbooks were in English, so everything we study material was in English, but all the lectures and the exams were in French. So we had to use 3 languages to be able to, so that helped shape our brain and, open some synapses and neurons that most people don't use to be able to kind of get and when they say when you speak 3 languages or more languages, that make you smarter, and that's
right.
true. And that's true for a lot of Lebanese because that's just the way the culture is, as you know. Lebanon, as you know, obviously went through ups and downs politically, and there's just so much you can learn there. And to get the latest and the most advanced, you have to come somewhere. At my class, half the people will either go to France to kind of finish their higher education, or very few from the French university come to the United States. So I chose to come here. But before coming here, I had to stop 1 year at the American University of Beirut to do 1 year of OBGYN. And there I met great people, and a lot of doctors there helped me make the connection to the United States, and I was able to come here to finish my schooling.
Why did you want the United States instead of France?
I mean, at the time it was clear that the United States was leading the world in a lot of technology, and I wanted the latest and the most advanced treatment available for my patients, and United States was and still the number one country in the world in technology.
Was it that easy back then? You decided you want to come to America?
It was very hard to come.
Okay.
And I think now it could be a little bit harder. So there are several steps a doctor have to go through to be able to come to the United States and practice medicine here. First step, you have to pass a series of 3 examinations called step 1, step 2, and step 3. And obviously you have to score really, really high in the highest 90th and higher 95th, 99th percentiles. After you do that, you have to apply here for multiple residency program, and you have to interview. And subhanAllah, I was lucky. During one of my interviews, one person recognized my professors in Lebanon, and he had good connection with them, and he said, I know that this is a great school. And that's how I was able to get a spot at Wayne State University for residency. So subhanAllah, was my good grades, but also that personal connection where I was able to talk to that person during my interview. I didn't know him before, but during the interview we made that connection, and also he helped me.
Wow. How old were you when you came?
I came here when I was, so I finished my high school at 18. In Lebanon, I did a medical school between undergrad and medical school in 7 years. So you can do the math. That was like 24 and a half. Then I did 4 years of OBGYN training at Wayne State University. Then I did another 3 years of fellowship in infertility at the University of Utah. Then I stayed at the University of Utah on faculty for years. I actually moved back to Michigan only 2014.
Wow.
Where I started practicing in Michigan.
So a bulk of your life was in Lebanon?
A bulk of my life in Lebanon, including my medical school. Then I came here for residency and fellowship.
That is so cool. Because, I don't know, at 24 is such a... It's that age where you're in the middle between figuring out what you want to do in your life for good, and like kind of starting
maybe
working.
Here in the United States, but Lebanon is 18. That age. I think people mature there for a little bit faster.
Yeah.
I mean, their life is more demanding, and people, I feel, mature much faster in Lebanon.
How do you think that experience, born, raised, and lived a big chunk of your life in Lebanon, kind of shaped who you are right now?
I think definitely shaped me well. Lebanon, people in Lebanon have, amazing work ethics there. Schooling is hard, and it's very competitive to get to these top schools. So kids in general in Lebanon, they study hard and they compete just because, it's a smaller country. Job opportunities are not as wide. And so you need to work really hard to be able to secure to yourself a good future. So that instilled in me an amazing, work ethics. And we found it here. Like most of us that come from Lebanon to come compete here, whether it's a job or school, we always see ourselves ahead. Alhamdulillah, that's an amazing thing. But also in Lebanon is small enough to, maintain that sense of community. So we connect with each other and we help each other. Like that person who connected with me who was Lebanese origin too. Like me, who did schooling in Lebanon and came here. So he connected together and he helped me, and we help each other, alhamdulillah.
That's so cool.
Mm.
I remember when I moved to America in 2018. I also lived in Lebanon, and I tried to go to school and it didn't work, and so I moved to America. And when I came, I went to Henry Ford, and I remember one of the teachers was like, "This is a very hard class. Not too many people pass. It's very hard to get a good grade." And then, like you were saying, the schooling regimen in Lebanon is very tough. It's like I remember you would be in grade 11, but they would teach us grade 12 material, and you always had to be, and it's like super condensed also, the courses. So it was a breeze, the class. And he asked me one time, he was like, why, like, how come you're great? Like, are you studying? He made me stand in front of class. Like, are you studying a lot? And I'm like, no, this stuff I already taken in like grade 10 and grade 11 in Lebanon. And it just kind of comes natural to you.
Mm-hmm.
So at that point, I realized like, oh, there is a very big gap in how we're educated in Lebanon versus here.
I think Lebanon is more advanced in the beginning of the schooling, up to high school. And I think in the early years of college is amazing as well. But there's a point where when it comes to labs and technology and advancement in science, where we rely a lot on the theoretical aspect of things. We can read it in books, know about it, but we don't touch it and feel it all the time.
Here you can be more hands-on.
Here, hands-on, obviously the technology gap and the resources that they have here. You're going to take that leap from, the book to the actual practice and to the latest in technology. There's certain things that just cost a lot of money to be able to deploy at the university level or in a classroom. And I don't think with Lebanon's budget that's possible. But here, obviously, being the wealthiest country in the world, and they do deploy. I've been very lucky, and my experience in the United States have been, obviously amazing. And it was truly a meritocracy here. I was able to work hard and achieve and compete with people who were born here, who may not, share in the same culture I have, or I did not feel I'm at a disadvantage in any way or shape. You work hard, you're going to find people that will help you and take you to the next level. And alhamdulillah, it worked for me, and I hope and pray to work for everyone as well.
We always say it's the one rule in America: the harder you work, the more you get. It's kind of that.
It's true. People want hard workers. They want success. I was worried. I speak with an accent, and I was not born here. The culture is foreign to me. I was not knowledgeable, and still don't know about sports, and that's like the most important social conversation here. I didn't know the history of the country. In Lebanon, we study more Middle Eastern culture and history and maybe European history, but we don't study much American history. So I have to give myself like a crash course on like reading books about the country and understanding the culture a little bit more. And with time, I grew up to love the system and integrate into it as much as I can without losing my identity or who I am.
How come you've picked infertility? Like, that's an odd field to
infertility. I had an early exposure to the field. So in Lebanon, I was during my medical school. We do rotate in Lebanon in multiple small hospitals. So basically, as part of your training, you do 2 years of study like in the classroom, whether it's anatomy of the body or the physiology, how it works, or what are the germs that exist in nature and how to treat them. But the last 2 years of medical school, actually they deploy us into these hospitals to get hand-on experience. So during my medical school, I was deployed in a hospital in the north of Lebanon, and there was a young graduate from Belgium who did IVF, and it was a new thing at the time. And I was just fascinated with the science. He was telling me we can do this and that and create a baby in the lab, a seed of a baby or an embryo, then transplant it into a woman's body and create a pregnancy with that. And this was like almost science fiction for me. And I was like, is this really happening? And so I got exposed to that. And this particular person was my dad is a middle school principal. So this particular doctor was a student for my dad. So, my dad taught him and was his principal for years. So then he went along to become a doctor and trained in Belgium and came back. So the world is small, like they say, and we made that connection and during medical school, and I was like, wow, this is what I want to do. But to be able to do it here in the United States, it's a longer journey. So you have to, do the 4 years of OBGYN residency, then subspecialize again another 3 years into a specialty called reproductive, endocrinology, and infertility. So basically, it deals with a lot of hormonal imbalances in the woman's body that can cause painful periods like endometriosis, irregular menstrual cycles like polycystic ovarian syndrome, fibroid, menopause, hormonal imbalance with the thyroid. But a big chunk of it is also infertility as well for men and women. So this is one of the fields where you start with, being a specialist in women's health. But when you subspecialize, you start talking about women and men health. Whether male fertility or female fertility, we cover at least the basics of both, and we do specialize in these advanced therapies as well.
If someone has never Googled IVF in their life, they don't know what it means, how would be the simplest and best way to explain it?
So the word IVF is obviously the acronym of 3 words: in vitro fertilization. In vitro meaning in the lab, fertilization. So fertilizing the eggs and the sperm in the lab. So naturally, when natural pregnancy happens, women ovulate one egg. The egg resides in an organ called ovary. They leave that ovary during the menstrual cycle in a specific time. This is called anovulation. Then naturally, the fallopian tube, which are the arms of the uterus, will pick up the egg and channel it to the inside of the uterus. When the egg reaches close to the uterus, the sperm naturally go and reach the egg and fertilize it inside the woman's body and create a seed of a baby called an embryo. That seed of the embryo start multiplying naturally, then reach the wall of the uterus and implant itself. And that seed almost like implant and start creating a baby naturally. So the sperm and the egg meet in the woman's body. There's many causes that prevent this from happening. One of them is the woman doesn't release an egg from the ovary, so the sperm can never meet it. Or the fallopian tube is not working, doesn't channel it to the uterus to meet the sperm. Or sometimes the uterus is hostile because of a condition in the uterus like a fibroid or endometriosis. Could be on the male level, like the sperm is not numerous enough for the egg and the sperm to meet, or not motile, they cannot move. There's a lot of sperm, but they're lazy, they cannot move. Or they could be deformed in shape. A lot of the sperm is deformed in shape. It could be physicality, like there's some barrier in the men or women to be able to be intimate together as well. So the in vitro fertilization make this happen in the lab. So we'll be able to extract the egg from the ovary and get the sperm and have them unify in the lab. So it's still from the women and the men. So from both of their DNA. And we fertilize them in the lab and support that fertilization with the technology. Now we're able to find an environment in the lab that mimic the woman's body. The same temperature, the same oxygen level, the same nitrate level, for example, the same CO2 level. We're able to provide the right nutrition for the embryo that's similar to nature. So we're able to grow the embryo for 5 days, up to 7 days in the lab. So when they reach that stage, is ready to be implanted, we take it from the lab and return it through the woman's natural reproductive organs to be able to put it back in the uterus where it belongs.
How common do people use IVF?
So when I did my training, we used to tell ourselves and the patients 1 out of 10 couples have infertility. A few years ago, the infertility diagnosis is becoming more frequent. So we say 1 out of 8. And last year, the World Health Organization estimated that 1 out of 6 couples will have infertility. So there's no doubt the need for any infertility service is going up and up and up and up. Multiple reasons for that. The main one is delaying childbirth. So if you look at the average age of first baby in the women, for example, in 1960s was 21, 22 years old, average age of first baby. Now average age of first baby is around 26 to 27. So that means the second baby and the third baby could be in the mid 30s to late 30s. And women physiologically, they're born with a set number of eggs. So at birth, the women are born with 5 million eggs. When they have their first period at age 12, of the 5 million, there's only 500,000 left. So 4.5 million eggs are lost between birth and age 12 when she has her first period. So almost 90% of her fertility is gone by the time she gets her first period at age 12. Then of those eggs that she has from age 12 to age 37, another 90% are gone. So age is a big factor. So women reproductively, even if their body is healthy, even if they have regular menstrual cycle, they take care of themselves, they don't smoke, they don't do major surgeries on their ovaries, they keep losing these eggs every month. So women, every month they lose around 20 to 100 eggs every month. So with time, their egg count go down and their chance of getting pregnant become less and less. And that decline accelerates at age 32 and become extremely fast after 40.
Do we know why in that first 12 years of her life they lose, like you just said, they lose around 20 to 30 a month? Do we know why in the first 12 years of her life they lose 90% of their...
So the more you have, the more you lose, if that makes sense.
Okay.
So because you start with 5 million, you're going to lose 5,000 a month.
Okay.
Then become, okay, now you have 500,000, you're using 100. Once you become very low, you lose like 10 a month.
Okay.
So you start losing less and less. And actually the number of eggs that humans start with is around 20 million. The 20 million when the baby is still formed in the mom's womb. So when mom is pregnant with the girl, and when the organs are forming and the ovary form, when the ovary form around 20 weeks, the ovary is formed with 20 million eggs. But the minute those eggs are formed, they start dying. So even before the birth of a girl, from 20 million, they're born with only 5 million.
Okay.
Eggs. So the eggs, the minute they're born, they start dying. So that time clock is there for a lot of women. In addition to the loss of the eggs also lose their ability to fertilize with the sperm with time. Because the egg is a unique cell that has to integrate with another cell. So take all our cells of our body, like our skin cells. Every cell in the human body have something called the nucleus, where the DNA is. It's almost like a safe inside that cell that kind of protect the DNA, because the DNA has all the precious information that the cell need to multiply, to grow, to function well, to produce what it needs to do. For example, the cell of the skin need to produce lubrication, need to produce a protection, need to grow at a certain rate. All this information for that cell is in the DNA. A cell of your eye need to also see, cell in your liver. Each cell have a set of instructions they have to work with, like a small machine that uses the instructions. So the DNA is protected in the nucleus against life, temperature, against cosmic radiation, against toxins, to protect us, to protect the information so we don't get cancers like cell dividing incorrectly. So all the cells in the body are so protective of their DNA except the egg. The egg DNA is more relaxed because it's waiting for that sperm to come and fuse with it. So the egg doesn't do a good job in protecting its DNA and is not dividing, not refreshing itself. So with time, in addition to the fact that the egg count go down, the DNA in the egg start breaking. So that result in a fact where when the sperm fertilizes the egg, the DNA combination is imbalanced. So the body rejects that pregnancy. So no pregnancy happen in a particular month. When the women get older, above 35, a good proportion of their eggs become damaged from a DNA perspective. So you get someone who ovulate a month, she's 35, but the egg's damaged genetically, but doesn't show that. It still ovulate nice. The sperm fuse with it, then the body say, no, this is not a healthy egg. And if the body failed to find out it's not a healthy egg, it will get pregnant, but there's another safety mechanism around 7 to 8 weeks pregnancy. The body recheck that pregnancy. Is this healthy genetically? If it's not healthy genetically, it will miscarry.
Ever feel like you have a message or a story or a vision to tell, but you were never really sure how to get it out there? Maybe you've tried posting online, but the content never stuck and it just felt like noise. I get it. And to be honest with you, most dreamers, entrepreneurs, creators, they hit this wall. But that's exactly what we do at Keep Creating. We help people like you break through. Whether you need a powerful video or a brand identity that feels like you, or a social presence that grabs people's attention for all the right reasons. This is what we do every single day. We don't just create content. We help people and brands tell their story in a way that actually connects with people. And because you listen to Not From Here, if you reach out and mention Not From Here in your application, you're going to get a discounted first month of services. So let's get your story out there the way it deserves. And now, back to the episode. Is that why a lot of women, or like you'll hear this a lot, where some women will think that they're pregnant and then
They
2-3
delayed,
months later,
exactly.
they miscarriage.
So a lot of miscarriages, and that's something we educate our community, in particular Arabic community, happen because of a genetic defect in the pregnancy and the egg. So it's a way our body is protecting us against pregnancies that could be deformed or genetically abnormal.
The body can know that by itself?
Exactly. So we don't know how, but the body is able to detect pregnancies are genetically abnormal, or could be a system in the pregnancy when there's missing genetic information, it collapses and fail. So either the pregnancy itself programmed to kind of self-stop, or the uterus is able to recognize it. In our community, a lot of people attribute miscarriages to stress or to physical activity. I worked too much, or I did some heavy lifting, or my husband stressed me out, or something like that. The physicality of miscarriages is different. Like when we take the miscarriages and study them genetically, we do find up to 60 or 70% of them are genetically imbalanced. They were never meant to live. And that's a fact of science. But most people don't know that. They start attributing miscarriages to all kind of other things.
Like what?
These are false attributions.
Yes.
They attribute
These are myths.
Like, stress. Dr. Hammoud, I was so stressed. This is a period of my life where I was so stressed, or I worked so hard, or I traveled like to the United States and I miscarried the pregnancy because of that. So all this, most of the time, there are some medical reasons for miscarriages, and we can talk about them later, but there are very few compared to most miscarriages are just a way of nature to select only the healthiest pregnancies. And because of that, the chance of miscarriage go up with the women's age. For example, if you take 100 women at 25, you expect 15% of them to miscarry. But if you take 100 women at age 35, you expect almost 30 to 35% of them to miscarry. If you take women at age 45 pregnant, you expect 75% of them to miscarry every pregnancy. But also 25 will be fine. And that statistics sometimes, unfortunately, a lot of Arabic curriculums don't teach statistics well. So for example, we say to someone, I'm sorry, you're 45, there's a high chance of miscarriage. You're probably better off not trying naturally. Let us take the eggs out, fertilize them, and choose the healthy one, DNA-wise, and put it back in you. And sometimes I hear an answer, but Dr. Hammoud, my aunt got pregnant at age 45, so why are you telling me it's hard for me? So what we say is, when we say 75% miscarriage, we didn't say 100% miscarriage. That means a person can be lucky, be one of those 25%, 1 out of 4, or could be unlucky, part of the 75 who miscarry. So either you play your chances, but the chances are against you, or you use the science to kind of make your odds better. So it's not a black and white, it's a percentage, if that makes sense.
Yeah. So what you're saying is some cases, stress and these factors that we think are causing the
don't.
miscarriages are
Not scientifically.
not scientifically. Okay.
So
But are there like specific times where stress might cause it or no?
not. I mean, look at,
Oh,
I tell
wow.
my patients, look at people in refugee camps. Look at humanity's history. I mean, the stress that we face right now is nothing compared to the stresses that happened 1,000 years ago.
That's
or
true.
wars, or if stress caused infertility, humanity will not exist. Does that make sense?
Yeah.
Most of the time, you know, it's a scientific cause for the miscarriage. Either the age of the woman causing the eggs to be abnormal genetically, and that's the most common cause, or could be a clotting factor where the blood flow to the pregnancy is being interrupted, and that can be tested for. Could be a thyroid issues. Could be a deformity in the shape of the uterus. Some women are born with the uterus that's, instead of being one compartment, is two compartments divided by a wall, called a septum. So that's a birth defect, and that's very common, and that's fixable. Some women are born with the uterus that's only one-sided, instead of having. So the uterus anatomically before birth come from two tubes. Those two tubes fuse together, like almost two cylinders, touch each other, and that wall in between them go away, forming one big cylinder. But some women, those two tubes never fuse. So they have two uteruses, but each one of them is smaller. So that causes a lot of miscarriages because there's not enough space for the embryo to grow. Or sometimes they fuse together, but that wall is still there. So we go cut it surgically and create that space again, for example. Unfortunately, some women, those two tubes don't form at all, and they're born without a uterus. But they have eggs, and those we can help them by taking their eggs out, fertilizing them. But for those who accept, we put it in a surrogate to carry the baby for them because they just don't have the capacity to carry their own baby.
So it's fascinating how the body can know, like, this is healthy, we're gonna keep the baby. This is not healthy, we're just gonna miscarry. It's crazy to think about. Even like you mentioned that we don't know why the body does that.
Which is amazing. It's a mechanism. So obviously nature and God created this mechanism to protect us against faulty union between sperm and the egg and the natural aging that happened with the eggs. Because of the natural aging of the egg, there's a choice, an option right now. A lot of women can choose is to freeze their eggs. Take someone who is like, let's say 33 or 34. She still have decent quality eggs and decent count of eggs. And she does not think that, she has the right, partner right now, and that could be delayed a couple years. And she's worried by 37, 38, her egg quality may not be good. She could be lucky her egg quality is still good, but statistically, luck is not on the side of many women. So they may elect to come to our offices, and we stimulate their ovaries, and we create 10 to 15 eggs, and we're able to extract them, and they can freeze them up to 20 years. So this way, when they come back, if they met someone and they were part of the unlucky one who their eggs DNA have been damaged with age, we can take those eggs, they are younger, from the freezer, fertilize them with the partner sperm, create the seeds of the baby, and put them back in them.
How long can the eggs stay frozen?
Up to 10, 20 years.
Oh, wow.
So we can use them up to age 55, even after menopause.
So that can happen also to, like, I heard of a cancer patient, I think that did
Exactly.
that.
We do that quite a
chemo
bit for
kills,
cancer. Exactly. We do.
Yeah.
I just did one for a 19-year-old. Unfortunately, she was diagnosed with brain cancer, but she did very well. Her parents were very aware of this option. They called our office immediately. We're able to stimulate her and freeze almost, 30 plus eggs for her. She did very well after the cancer therapy, but unfortunately it killed most of her eggs. And now she has those eggs frozen. She can come back to them anytime.
She comes before she starts chemo?
Before she starts chemo
Okay.
or radiation.
Okay.
And same thing for men. Men who are diagnosed with lymphomas or leukemias and need chemotherapy that can kill the sperm, they can come freeze the sperm as well, and we do it all the time. So we freeze it for cancer, we freeze it for socially, when someone, for women, men don't age that way. So men continue producing sperm until they die, no fresh sperm until they die. So they don't need freeze sperm just if they're old, but women, they do need to do that with age. We can freeze eggs, and for like someone have a tumor that's benign on the ovary, and they have to go remove that tumor. When you remove a benign tumor, even if it's not a cancer, any surgery on the ovary kill eggs too.
Okay.
So some women have conditions like endometriosis cyst, and they are in so much pain because these cysts cause pain on the ovary. They have to have a surgery with a gynecologist to remove it, and they can kill a lot of eggs with it. So if they don't have children, or they don't have enough kids, if they have one but they want 2 or 3, they can come to us and we can extract the eggs and freeze them for them. This way they can have the surgery, then when they heal they can come back, use their eggs.
Wow. So everything you explained so far, it seems like we just talked about the woman's side, and from what you're saying, a lot of it comes by birth. There's no control over if there's a wall or not. She was just born like that, correct? What about the men's side? Like, what about sperm? Is it also something with birth, or are men lacking maybe health-wise, and that's why the sperm isn't as mobile enough to get into
There are some conditions related to the genetics, how the person is made, that can cause the sperm not to be mobile or not to be produced in enough quantity to fertilize the eggs, or not in the normal shape as well. And every time I say, and also there are some conditions we're going to talk about that are related to lifestyle or choices a person can make in their life. The genetic causes are dominant. So that's the majority of the cases. And every time, sometimes we tell a person, I think you may have a genetic condition causing the sperm to be low in count or inexistent or severely abnormal. The first thought that comes to their mind, but I don't have a family history of that, because most people equate genetic causes to familial causes. And sometimes I tell them, genetic work in an interesting way. So, for example, my DNA come as a copy of my dad and mom DNA combined, but it's a copy of their DNA, not their DNA.
It's not a replica, yeah.
It's a copy. I copy it. And I tell them the copying mechanism can be defective sometimes. So while I copy my DNA from my dad and I copy my DNA from my mom, sometimes the copying mechanisms come back abnormal in a way. The best example I can give my patients, if you're copying a paper on a copying machine and you move a little bit, what does the copy come like?
Yeah.
With all these lines that are waved, and so the copy sometimes is not identical to the original, just because of all kind of issues that happen in the cell. So the same thing, like my DNA could be slightly different than my dad's DNA or my mom's DNA. While my dad is very fertile, or the patient's dad can be very fertile, or his mom, but his copy of the DNA unfortunately is damaged, causing the cells that are responsible to make the sperm don't have the right instructions how to make the sperm. Because everything in our body works in that instruction that is in the DNA, in that safe of the information that the DNA and the cells that we talked about. So if the instructions are missing a line or word is misspelled, the cells come, read those instructions, then it stops. Like, okay, I don't know how to make sperm because I don't know how to read that word. And literally the whole system shut down and you can't do it. In the future, there are some technology right now, we can send viruses to these cells and edit that DNA and fix that word that's misspelled and jumpstart that process. So there's a lot of research on that, and hopefully it's going to be available in the next 5-10 years, but not available yet, unfortunately. So that's a majority of causes of male infertility, is that DNA is misspelled. And the words that misspelled could number in the thousands and thousands. There's so many processes in that DNA could be defective in a way where it's hard to pinpoint. So persons say, okay, if you're saying DNA, which one? Can you test it for me? Can you confirm that? The answer, unfortunately, no, because there's thousands and thousands of possibility, and each one of those tests is $1,000. So it's not practical to spend $1 million on a person to try. And there's still a lot of this unknown to us yet. We know it's a DNA, but we don't know which word is misspelled yet. So that create that gap of like mistrust of the patients say, even though the science say, like for example, the number of genes we used to know that cause male infertility 20 years ago were like 10. Now we know of like 3,000 of them. Think of 10 years from now, we're going to know of thousands more if you follow that graph.
Right.
But there's no test for that. So that's that. But that's a cause most of the infertility in male. But what can cause infertility in male that is reversible related to their choices in life, for example, smoking. That's very bad, whether it's narghile, whether it's vaping, whether it's regular cigarette, whether it's marijuana, that's have been proven to lower sperm count. But not everyone, that smokes will have a bad sperm, but more likely to develop bad sperm. And people see around them people smoke and have kids fine. Yes, I mean, they're lucky, but not everybody is that lucky. Your DNA or your body, the way it works, makes smoking bad for you, if that makes sense. So you have to be careful about that. Overweight also affects sperm.
How come?
In a negative way. So the body make a hormone called testosterone, the testicles. And testosterone is very vital for the sperm. It's like the male hormone that causes the hair growth in male, support that sperm to be produced. So men need to produce high levels of testosterone for the sperm to be produced. Testosterone get broken in the fat tissue into another hormone called estrogen, which is a female hormone.
Okay.
So the more weight a person put on their body, the less their testosterone, which is the male hormone, and the higher is the female hormone in them.
Interesting.
So
fat makes testosterone turn into estrogen?
To estrogen.
Wow.
So that's why like bodybuilders and things like that, they take what we call an aromatase inhibitor. It's a molecule so the enzyme that turned that testosterone to estrogen in the fat called aromatase. So people stop the aromatase from working to raise their testosterone levels, to build muscle mass, to be able to become stronger. And we use it sometimes in male to boost their sperm as well.
Okay.
So that's one cause that can be reversible, being overweight. Another cause that we see not uncommonly is those guys who are training to be to go to the gym, and they compete and they want to lift weight. So sometimes they take steroids to be able to because testosterone, to be able to build stronger muscles. Testosterone give a false signal to the body. Oh, I have a lot of testosterone coming from outside. So the testicle actually shut down itself, because you're getting tons of testosterone from the outside, so you don't need to produce any sperm. So basically the sperm count go to zero.
Wow.
Zero. So a lot of bodybuilders come to my office like, Dr. Hammoud, we're not able to get pregnant. I use the steroid. I feel strong. I was like, oh my God. I mean, steroids right away. You see it, you test their sperm, there's no sperm whatsoever.
No sperm?
No sperm, because it's like a birth control for men. 90% to 99% develop zero sperm, but there's every now and then I still see normal sperm on testosterone. So not everyone, but majority will develop that. And unfortunately, a lot of general physicians don't even know that information. So a guy will go to his primary care doctor and say, me and my wife are trying to have a baby, and I may have, problem in the bed. I don't have that desire strongly enough. They say, okay, let me test your testosterone. They test their testosterone, is a little bit low. Then they say, okay, let me give you testosterone to boost you. So they give them that testosterone, they feel better, but their sperm tanked. And they just don't test the sperm for them. They focus on the testosterone without testing the sperm. So that's a common problem we see in the community quite a bit.
So how would you combat that?
So they have to stop the testosterone, and we give them a hormone called HCG, or we wait for the sperm to come back on its own, but can take up to 6 months to a year to come back to normal.
But I mean, that doctor only gave him testosterone without testing the sperm.
Mm-hmm.
What would be the alternative to that, in your opinion? Would he
Give them lose weight to boost your testosterone, to get your aromatase, not to get that female hormone too high. Exercise. You can get that pill called aromatase inhibitor to boost the testosterone naturally, or give them a medication called Clomid, for example. So there are some alternatives that help them.
What you're explaining, a lot of it turned out to be genetic. Like that's just how you were born, on both sides, and
because of that, a lot of couples will need IVF. That's why, because most people, like when they see a fertility specialist, they're hoping for an answer like,
you don't need it.
You don't need IVF, and you take that pill or eat this herb or do this, for example, something simplistic like that. And thank God there are some cases, I know, like this one, testosterone. Somebody young come to my office, he's on testosterone, and his wife is young and they're not able to have a baby. We test his sperm 0. So easy fix, stop your testosterone, come back in 6 months, sperm is fine, they get pregnant just fine, no issues. So that's an easy fix. But when we come older, we're already, eggs are low in count, egg are low in quality. You tried all the vitamins, your sperm is super low, or infertility for 5, 7, 10 years. That's not going to be a quick fix, if that makes sense. But thank God we have IVF, because without IVF, those couples will either never get pregnant or have like a 1% chance of getting pregnant. So now with every try of IVF is 60%, 2 tries 85%, 3 tries 93% to 95%.
It's that high.
4 tries 97%. So this is very powerful. You talk about couples who've been all their life waiting for that baby. But the key is to do it when you're young. IVF. So the woman when she's young. Because if I take the eggs out, I take 10 eggs out from someone who's 45, and I fertilize them all and test them, and say, I'm sorry, all those eggs are bad. I cannot put anyone in you. So I don't have that first try even. So then I have to do second harvest, third harvest, fourth harvest to find a good egg. As opposed to when somebody is 35 or 32, I may find 3 good eggs the first round, or 4. So I give them 4 tries with it.
So do you see that people generally come in when it's too late?
A lot, especially in our community. They're very hopeful. They say, okay, Dr. Hammoud, I do it only as a last resort, because it's expensive sometimes for them.
You're saying it shouldn't be a last resort.
It should be the first resort, because you want to invest your money when the market is down, not when this market is high. You want to invest your money when the egg reserve is good and when the egg quality is good. But when the egg reserve is low and the egg quality is low, you're going to have to do it multiple times. So you're going to have to pay a lot more and not expect the same results. So the younger you are, you do IVF, the better your success, and you can build a whole family with one harvest. For example, I saw a patient today. I saw her 2 years ago. She's a doctor. She did IVF very young because she understands this process. She's been trying a year and a half. She's like, I'm not going to waste my time. I'm going to jump on it because my eggs are young right now. We're able to find 3 good eggs in her. I put 1, got a baby, the other one frozen. The baby is 15 months. I saw her today. She's like, I'm ready for my second egg. She take it from the freezer, put it back in her. So that she can have 3 babies in theory with that 1 harvest. She did 1 time because she's young. As opposed to needing to do 3 or 4 harvests to get 1 good egg.
How long do you think couples should wait before they go into IVF? So how long should they try before they're like, okay, look, this is not working, we got to go see an IVF?
Depend on the age.
Okay.
So if they're
Let's
less
say
than
early
35,
20s.
well, yeah, early 20s, very few people have these issues.
Okay,
So
cool.
less than 35, you wait for 1 year. 35 to 40, you wait 6 months only. At 40, you should see the doctors immediately
Okay.
because time is like extremely important. Just to at least do the testing and learn your options and decide what you want to do.
Under 35, you try for a year.
For a year, then if you're not pregnant, you see a doctor. That assuming everything is fine. Like if someone is under 35, even if she's young, she's 25, but her period come once every 3 months. That's abnormal. That means she doesn't ovulate every month.
Right.
Or a guy have a history of like the testicle was not born with him. He was born, then a testicle came later. It's called a cryptorchidism. I don't know if you heard of things
Never.
like that.
No.
Some boys are born with their testicles stuck in their belly. You know, after 6 months of birth, it descend into the scrotum.
Oh, okay.
So that's not uncommon actually.
I've
So-
heard about it being born in the belly, but I didn't know that it will drop later.
It will drop, or they can do surgery
Okay.
to drop it. So that's a flag there, because the testicle, when it gets stuck inside the belly for a time, it can affect the sperm. So that's a indication. Hey, you know, don't wait a year. Test yourself ahead of time. Women who had major surgeries, for example, they could have scarred their fallopian tube and blocked them. Sometimes have to preemptively, you know, test their tubes and make sure everything's fine. The problem is with people testing, they worry about the results. Like, I don't want to test. What if something bad come?
Yeah, it's
And
scary.
it's scary a little bit, but in the same time, better to know than not know. And that's one of those. Is if you have the right mindset and you're a logical person, you don't want to hide the problem, like they say. You want to tackle it and know about it and be able to plan, because that will give you over the long run a better way to plan your life, instead of, you know, sitting on a problem that can become bigger and bigger with time.
There's a lot of shame that that's attached to IVF. Like we're talking about your clinic, and me and my coworkers talk about it all the time. We'd be walking, and then you'd see people with masks, hoodie down, and they just rush into the clinic as soon as the door opens, and you almost feel bad because they don't want anyone to see them. They don't want to be recognized. They don't want to know people to know that they're
this
having.
is definitely changing. Obviously, I've been practicing, you know, for quite a bit. I'm going to tell you a funny story.
Yeah.
You know, I've been in Dearborn for quite a bit since 2014. But our main clinic is in Bloomfield Hills, as you know. Maybe you've seen it on Woodward and Big Beaver. This is where we do our surgery, take the eggs out, fertilize. So my days usually in the morning I'm doing these surgery in Bloomfield Hills. In the afternoon I come to Dearborn to do but my patients come in the morning here to do their ultrasound with the nurses. So I had 2 sisters who are patients of mine. They didn't know that both of them, you know, are seeing me. Because of that, you know, they didn't want anybody to know. And both of them, they said when I saw them first time, Dr. Hammoud, we don't want to come to Dearborn because we don't want anybody to see us here. So we're going to see you in Bloomfield Hills. And both of them went there and they saw each other in the waiting area of Bloomfield Hills, because both of them had the same thinking process. They didn't want anybody to see them. But thank God this is changing. And the people, like even Arabic people, are on social media, you know, telling people about their struggle with infertility, telling that there's, you know, options, and people, you know, recording all their journeys and making all these, you know, positive come out of it, that there's a treatment and for it, and it's changing big time.
Where does the shame come from originally, in your opinion?
I think like anything else, you know, just feeling that, you know, your body is defective of some sort, like there's something wrong in you, if that makes sense. Some families, they start, you know, the families don't understand well, and they start, you know, saying, oh, she have a problem or he has a problem, and that comes a little bit outside, and people, it's more cultural than anything else, I think. Lack of knowledge as well.
I think in our culture, a lot of it is you get married, so it's like that belak joke, and every time people tell you you get married, and then you get married, and then people start asking you, where's the kid?
With the kid,
and in our cultures, like
pressure.
we get a lot of kids, like it's in our culture. So when you're kind of starting to get asked those questions, hey, where's the baby, and you're having problems, but what are you gonna tell people? Like, I'm having trouble get a kid. Like it's a lot of noise.
Well, there's nothing wrong about it, but it has this taboo factor in our culture. Hard to tell where is that coming from. Like, I tell people it's like, having a baby is a physiological, biological process that can fail like anything else. Sometimes your eye don't see well, or you don't hear well, or you don't swallow well, or your stomach doesn't digest food well, or you're born with your knee having problems. Same thing. All these organs get sick and need to be treatment. It's not your choice. It's not like it's your choice to choose to have infertility. It's a sickness that you got, like any other sickness that people get. There's no shame in it, and when you're ashamed, it's not something you've done to yourself.
Yeah.
And you don't control it. And thank God there's amazing science right now that can help you achieve as many kids as you want.
Yeah.
As long as you address it early and you choose the right route.
Oh, absolutely. And I think just like women in general want to have kids. They want to be moms. You hear a lot of women say like it's their dream to become a mom. So you can understand when it's not going her way and she's not being able to have kids the natural way. She'll be like, man, like, am I less of a woman now? And then you have the man with the manlyhood,
Absolutely.
they're like, am I less of a man because I can't get my wife pregnant? And I understand how it's difficult to wrap your head around it. But like you said, it shouldn't be taboo where you're struggling with it on your own. Like there are resources and you can get help, and you just laid out the percentage of like success rates, and those are very high percentages. Like You're talking like you can get to a 97% success rate. You can have a child. Like that's not just something you say. It's a big deal.
No, it's a huge deal, especially if you tackle it when you're young and you still have the capacity to produce good eggs and good sperm, if that makes sense. But the most difficulty we find is when people like delay it, or they don't have the resources to be able to afford it.
Does it cost a lot?
It's costly. So, but thank God, 10 years ago, it used to be 5% of insurances pay for it, but now 50% of insurances pay for it. So all big employers like GM, Ford, Henry Ford, Corwell Health, all the big employers around us have full coverage for it.
For IVF?
For IVF.
Oh, really?
Absolutely. Huge coverage for it. So that means, there's a lot of those patients sit on these diseases, they're not knowing that, sometimes I get a Ford employee and they've been struggling for 4 years and they say, Dr. Hammoud, we cannot afford IVF. I was like, what do you mean? Like IVF is covered. You get four free IVF cycles through your insurance. Or you work for GM, you get $40,000 in fertility benefit. You work for Amazon, you work for Starbucks, you work for Corwell Health, you work for Henry Ford Health System, you're for banks, Delta Airlines. All these major employers have amazing coverage for this, and a lot of people just sit and wait. They don't even know about their own coverage. Phone call to your HR. A lot of people confuse their insurance coverage for IVF coverage because they don't know that IVF is like dental, sometimes separate from your insurance. So you may say, okay, you call your insurance, they say we don't cover IVF. But you don't know that your company have another plan that cover IVF called like Progeny Health or Maven Fertility or Carrot Fertility. It's like Delta for example, for the eyes or the teeth. So these are separate insurances that big employer buy. So they have to talk to their HR department to be able to understand their coverage. But IVF use right now is even beyond the fertility issue. Our ability to test the human embryo can be used for other conditions. For example, couples don't have infertility. They're able to get pregnant naturally. They got pregnant and they found the first baby have a genetic defect naturally.
Why doesn't the body discard that baby?
So it depends on the size of the genetic defect.
Okay.
So if it's a small genetic defect, and where is it in that book of genetics? If the genetic code allowed the person to create the baby and form the heart, form the lung, but only a tiny small portion of the heart not working well, but still compatible with life, but not perfect life, it escaped that system. Does that make sense?
Yes.
When a full page of the genetic code is missing, that's not compatible with life, that shuts down. But when the tiny small area or one word is missing, causing genetic disease, that escape the system of so it's not foolproof. It tests for big things. So when they get that first baby, then it's like, oh, how did this come to us? Then they test the parents, and it turns out they carry the traits for this disease. So the genetic code and the way the body is designed, we have a main copy of the genetic code and a backup copy. So we have 2 copies of the genetic code, all of us. The reason we have that, because over thousands of generations of passing along, copying that genetic, some copies came back abnormal. So because of that, a lot of people will have diseases.
So the original would be good, but the copy would be
No,
bad?
there's 2 copies. One came from your dad
Yes.
and one came from your mom.
Correct.
You're hoping that whatever wrong in your mom's line is not wrong in your dad's line. Does that make sense?
Yes.
So the chances that both are wrong in the same word is very low.
Right.
So that's why most people are healthy. But you could carry a defective copy from your dad or a defective copy from your mom. But vice versa, the dad's like number 5 pages bad from your mom, but good from your dad, you're fine. But number 3 pages from your dad's bad, but it's good from your mom, you're fine. But you give your son a bad number 3, and he get a bad number 3 from mom too. So he has 2 bad number 3s. So dad is healthy, mom is healthy, but the baby got the bad copies from both of them. So the baby is unhealthy. And now we find out that both mom, the wife, and the man carry bad page number 3. That's problematic. Are they going to give the baby the healthy number 3 or the bad number 3, healthy number 3? So you can get healthy babies or bad or unhealthy babies. So we tell them, hey, don't have babies naturally. Come to us. We take 10 eggs, we put the sperm in them and test the copies. Do you have 2 copies of bad, 2 copies good? Take the good one and put them back in them.
Interesting.
So now they're not going to have a baby with birth defect, even though naturally they will have a baby with birth defect.
See, that test by itself, how much would that cost people? Like, is that more relatable?
Could be covered by insurance as well.
Okay.
It's the same thing. But that does require IVF, to taking the eggs out, fertilizing in the lab. But any couples like yourself, you shouldn't have babies naturally unless you test yourself and test your wife for all these bad copies that are known, to make sure that you don't carry 2 bad copies on the same area. It's a blood test for you. It's cost $200.
Oh, so it's just, so that test.
It's called carrier screen.
Okay, so it's just a regular test
And
that
your
you could
OB/GYN
go.
office called carrier screen. Before having babies, you go there and just...
You'll be able to know, for example, if the 4 and 4 are diseased.
Exactly. But I warn people, you're going to find diseases in yourself. But as long as they're not in the same area as your wife's, not same page, same line, same... As long as they're in different one, you're fine.
And then if, God forbid, if, let's
They
say,
carry,
both
don't
are,
have babies naturally.
yeah, if both our 5s are diseased.
And especially for cousins. Because
Okay.
they come obviously from families that copied each other similarly. So they may carry the same damaged copies. So we see that more often in cousins as well.
Okay.
And as you know, obviously that's something that happened more common in the Arabic community, to
Right.
marry cousins from a mom's side or dad's side.
So when they walk into the office, usually into your clinic, how is their morale? Is it typically positive or is it typically negative? What do you see from them?
I mean, depend on their level of knowledge of the issue and where they come from. We see people from all walk of life. I saw a patient today. She's an immigrant from Bangladesh. Her medical knowledge about her body and herself is very limited. Her language skills are very limited. And she was very stressed, coming here. She doesn't understand, the terminology. What's a DNA in the cell? What's a cell? What's an embryo? What's an egg? What's a sperm? So this is, you can tell physically she's stressed, to be able to kind of, help her understand the basics. And she's desperate. She just wants a baby, for example. Oppose that to someone who's in the medical field, who's a doctor, who's, know the basics, who've read about their options. They understand. They come with a pre-existing and a plan. They come hopeful. Okay, this is what I want to do. This is going to be my success. So, it just depends on the level of the person. Then obviously our job is to kind of de-stress that person, help them understand what's going on, what other tests we're going to do. Also, there's a lot of concerns about the cost. We see that quite a bit of our patients coming to us. They're worried, and the reality is, unfortunately, IVF is very costly. It can cost, with a more advanced treatment, somewhere between 15 to 25 or 30,000 sometimes
Per cycle?
per cycle. And that's the advantage of doing it when you're young. Because if you are paying that amount of money to harvest the eggs and test them, you want to do it when you have a chance to get 4 or 5 good eggs out of this money. Because that gives you 4 or 5 chances at transferring them.
Okay.
Because the costliest part is like stimulating the ovaries, taking the eggs out, fertilizing them, testing them.
So what's the definition of a cycle then? Is it just the harvesting? Is that the cycle? What do you...
Historically, in the past, we used to take the eggs out, fertilize them, and return them in the same treatment.
Okay.
But that has been gone for a while.
Okay.
So now we divided an egg retrieval cycle and an embryo transfer cycle.
Okay.
So we separate those.
And those people pay for them separately?
People pay for separately, a la carte. Like you do 1 egg harvest and 3 transfers. So you pay for 1 harvest and 3 transfers.
Okay.
But the transfers are much, much cheaper than the harvest.
The harvest is
The
expensive.
harvest is like 80% of the cost.
Oh, okay. That's why you're saying
So
start early.
Start early, you pay 1 time a harvest.
So that patient that you were talking about paid for that harvest 1 time, got 3 good eggs,
Exactly.
and now she's good.
She can pay for 3 transfers, which is much cheaper for her. As opposed to somebody who's older, they need to pay 3 harvests or 4 harvests to get 1 transfer, for example. And that's
Okay.
become very costly for them, like real costly. And people don't realize that. They're thinking, okay, I'm just waiting, maybe I'll get a chance. In reality, some people get pregnant naturally. So the odds, like when somebody, we call them you're infertile. I'm sorry, you have a diagnosis of infertility. We're not telling them you're sterile, that you're not able to get pregnant. We tell them your odds of getting pregnant every month is 5%.
But there's still 5%.
So 5%, but there's 95% you're not pregnant every month. Are you going to be in the 5 or the 95? Hadi ala Allah. But a lot of people end up being in the 95 statistically.
Yeah.
I tell people, like, you don't quit your job and say, I'm going to play the lottery every day because there's a chance I become a millionaire and I don't have to work again. That doesn't work for a lot of people.
Right.
Even though there's a chance you're going to win the lottery and become a millionaire and not have to work. But is that practical for you?
No.
Same thing for fertility. If there's a 5% chance of getting pregnant, that's not practical. Just keep waiting for that 5% to hit home. Because with time, you're hurting your own chances of success with IVF. The older you get, instead of having 1 harvest and 3 or 4 transfers out of it, you're setting yourself up for a situation where you need 2 or 3 or 4 harvests because you're getting older and your eggs are getting older. So that's a big gamble you're taking. So that's a decision every side. But one thing I'm very proud of our clinic is we were able to push a program called First Steps. That program say if you guys together make less than 135,000, you get 30% discount.
Wait, if both of them make...
If together, joint
Okay.
income, less than 135, which is a lot of people in Michigan,
Yeah.
you get 30% discount. If you make less than 90,000 together, you get 50% discount.
Oof.
Okay, then add that to a payment system as well that we have. So really become affordable. Like, I tell you, like, if you cannot afford $15,000, you're not going to be able to afford the baby.
Yeah.
True? I mean, babies are expensive. Think about it.
And you have payment plans too.
You have payment plans as well.
Okay. Okay. So it's attainable, really.
Absolutely.
Okay. When they walk in, how often is infertility caused by the man versus the woman? If you were to...
50-50.
50-50.
50-50. Most women come and they say, Dr. Hammoud, I want to start by myself first. I say, you're wrong. You start with your husband first. Because that's a simple test. Semen analysis, 50% of the time we know the cause.
Okay.
50%.
That's statistics on paper. When they walk in, usually who do they think the problem is from?
90% of the people think the women.
Really?
Mm-hmm.
And what does that do to the man when he knows it's actually from him?
They don't believe it. They don't come for their sperm test. So we finish all the sperm tests, like all the women testing, and the women have to go through more invasive testing and a blood test and a test of the uterus, test the fallopian tube, test her egg reserve, test her genetic, test her ovulation, test all her hormones. And the guy has to come for that one sperm test, and he keep dragging it, hoping that maybe something doesn't show on his test. That's a common behavior we see. We say we wish, but there's some people are knowledgeable. They say, you know what, let me start with him first. I have couples sometimes they say, Dr. Hammoud, we want to start with him first because we read the literature and we understand that it's a male infertility 50% of the time, and we want to tackle it right away.
Really? So how are the conversations that you have with the man at that moment? Because you're a man, he can relate to you, you can talk to him. Does he kind of accept what you're telling him? And what are the words that would make him comfortable?
We obviously we explain to them some of these statistics. I mean, by the time people come to a specialist, because we are a specialist, I think a lot of people when they come to us already made their mind. They're here to be helped, if that makes sense. They've seen their primary care, they tried the home remedies, they spoke to their mom and dad, and they tried what the neighbors say, they tried their general OBGYN. So now they tried all this, they came to the specialist. So there's some level of credibility to what we say,
right?
Because okay, now I'm escalating it to the real specialist. And people expect, when they come to a clinic, a lot of people expect, some people still unfortunately in denial. There's maybe, he's going to say there's nothing wrong with me, or they may say, and that's normal. Like nobody want to hear, that you need IVF, for example. But alhamdulillah, a lot of people are logical. We break down the causes for them. We say, okay, this is what science say. This could be the problem. 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 And we say, this is what we're going to do to test this. And if we find this issue, this is what we're going to do for that. Then I give them options. You say, one of the options I give them is you can wait. You're young, for example. Somebody come to me, 25 years old. Yes, the sperm is terrible, very deformed in shape. Their odds of success is 5%. But I tell them, you're no rush to do IVF right now. You can wait until 30, it's fine. If you want to take it and get that 5% every month, you may be lucky and be successful in a year or two. And if your egg reserve is good, you're young, there's no reason for you to rush if you're not ready for it. Flip the narrative. Somebody come to me 37, 38. They've been trying for 7 years. I may be more directive and say, and talk to you like I tell her, you're like my sister, you're like my brother. Here's an age where every year count against you. Costly. It's going to be costly to delay that treatment. And these are your options. You can wait naturally, but I don't recommend that. You can do something simple like take fertility tablets, or something called IUI, where we wash the sperm and strengthen it and put it in the woman's body to reach the egg faster.
Oh, those are
that's called IUI, or insemination. Before
you wash
IVF,
them?
Wash the sperm.
Okay.
Because naturally when the sperm is ejaculated, half of it doesn't move.
Okay. That's natural.
Natural. And a lot of it is deformed. That's natural because men produce billions of sperm and millions. So a lot of the sperm come out not good quality. So by washing that sperm and creating a good pool and stronger pool of sperm and delivering it very close to the woman's egg through a long tube to reach the woman's egg, facilitate that process of union sometimes.
Okay.
But the success of something like that is 10 to 15%, as opposed to 60, 85, 90% with IVF. But that's better than the 5% that the couples are dealing with at home.
Right.
So if somebody's young, I may say wait or do IUIs, for example, then come back up for IVF when you're ready for it. But if I did their blood test and they're already low in egg count, or I look at their age and I see you're already at 37, 38, that's we'll call it fast track. I'm going to fast track you and say, hey, we should have that IVF conversation sooner than later, because if you delay the IVF 2 years, you doubled your budget or tripled your budget, because you have to do 2 or 3 retrievals, and starting with $10,000, $15,000, that's like $30,000, $40,000, and that's for most people very, very expensive
That
unless
is.
they have amazing insurance coverage. Do it when you're young. You get that 50% discount. Now your whole IVF cycle could be less than $10,000, and you don't need these fancy IVF that is more pricey, and you're in good shape.
Me and Dr. Ahmed throughout this conversation talk a little bit about health and the impact that health has in having babies. And the best way, in my opinion, to track your health and make sure that you're on top of your game is through Whoop. Whoop is this fitness wearable that is meant to be worn 24/7. It's not meant to leave your body. And it tracks the most vital aspects of your health. And they just released 2 new pieces of hardware. They're two new devices, Whoop 5.0 and Whoop MG. And they just took it to a whole new level when it came to health tracking. And because you listen to Not From Here podcast, you actually get a month for free. When you go to join.whoop.com/notfromhere, you're going to see a discount on their subscription packages. And that's only because you're a listener of Not From Here podcast. This device changed the way I go about my life, and I guarantee that's going to do the same for you. So give it out a month for free. If you don't like it, it's as simple as returning it. And again, that's join.whoop.com/notfromhere, or just visit the link in the description below. And now back to the episode. How does infertility affect the couple's relationship? Because I mean, we talked about this a little bit earlier, but people want to get married, they want to have kids. And does that affect their dynamic at all?
Like any decision making in a couples, they have to work as a team. That comes from which couch to buy for your living room to what house you're going to buy and what's your budget for this and where we're going to go on vacation if we and where. When it comes to like fertility, obviously, women's are wired a little bit differently. I think they're more in tune with their bodies in terms of aware of the age effect, so they're going to push more for earlier visits and more aggressive therapies. The men are going to be hopeful and they're going to say, maybe waiting a little bit, maybe you shouldn't, pay that amount of money right now. So we're going to see that dynamic. It's not uncommon. Like the women's kind of looking, is like, okay, I'm 37, I cannot wait longer. And the man's like, what if we wait one more year and see what happens instead of us paying $10,000 or $15,000 right now? I can see both sides. You're hopeful because it can happen, but also it's a risk. You don't want to take that risk as well.
But you think
it's kind of like, where is that? But sometimes there are self-blame, like blaming each other.
That's
like,
what I meant.
Exactly. So I was just listing the stress of the financial, so that can create a stress to the relationship. Second is that issue of, whose fault is that? The reality is nobody's fault. Like, it's not a decision you made. Like you went and gambled your money, your household money and lost in the casino, or you did a bad decision, or you drank alcohol and you ruined your liver, or so the complete concept of blaming each other is incorrect. It's like, God forbid, a person's married and he developed lymphoma and he couldn't work anymore, or she developed something and she didn't. It's not like, okay, I'm going to blame you for developing a lymphoma. And that's where people marry, to be a team, if that makes sense.
Yeah.
So, but unfortunately, some of these marriages, they're not built well, or they don't understand how to deal with their stresses. Well, but that's come counseling and families and us, explaining to them this is a biological process. It's not that she made a decision that make her not able to, have babies, or he made a decision. That's something they're born with, if that makes sense. Out of your control. It's a challenge, like any other challenge a lot of couples will face, not only on that, but also on raising their kids, buying a house, making sure they make the right financial decisions in every step of their life.
But have you seen it personally inside of the office? Like, does that conflict drag into the walls of your office?
Unfortunately, yes.
Okay, so what are kind of the things that you see?
We sit down and talk to them. Like we work. We sometimes they're really fighting.
Like the blame in front of you?
Yeah.
They play the blame game in front of you?
They're yelling at each other sometimes. But that's rare. That's rare. Most people are able to understand
I mean, like you said, it's an emotionally charged environment, you know?
Not really. Like when you come to a doctor's office, like we're very non-judgmental about that, and because we have a lot of experience, we can detect clue of tension before it boils to a point where there's something. I can, from the tone of like how they're talking, and I can see the men and the women. And when you do this like for 20 years, like myself, you get to a point where the minute you feel that there's some discomfort in any party, you change that conversation to something different. Then you start explaining things and be able to understand. So then suddenly the couples, will absorb that information and are able to get to a point where they can see the facts, they can see the options, they can see, that this is something, they can see a solution together. So we work in a way where we prevent something like this from happening. But what happened at home, what happened when, his mom interfere or her mom interfere.
That happens as
There
well?
could be positive
Okay.
interference, but sometimes it could be negative interference.
And you see that negative interference?
Very rarely, thank God. Most
Okay.
people are very aware of this. The society is advancing, and most people are knowledgeable. They read and they understand. They hear podcasts like yourself. And the information is way more spread nowadays. And that helps a lot.
I when I said emotionally charged, I meant like in the household, it would probably be an emotionally charged just environment because of the sensitivity of this
Honestly,
is our child.
I see it the other way around. Like a lot of couples come together stronger for that.
Oh, that's
Yes,
good to hear.
absolutely. That's like absolutely. It's like any challenge, like either breaks or make you stronger, like you said. And for a lot of relationship, that make them closer to each other in terms of like sharing decisions and because that's an experience and that's a struggle that's personal to them. So when you share with someone a struggle like that, a lot of time that bond is way stronger, and the appreciation for the success is stronger. The appreciation for that success with the baby is stronger. So that baby is going to be an amazing, when they get pregnant, both of them, obviously crying in the room. We hear the heartbeat for the first time. That relationship is phenomenal between the couples, and they appreciate more having kids. Some, I see sometimes people get pregnant easily and all that, and they say, my kids are not listening to me and things like this, and they start complaining. I don't blame them. It's not easy to raise children nowadays. But at the same time, for couples in our clinics, it's not something that doesn't come naturally. They have to work very hard and sometimes sacrifice a lot of things in their life to be able to do it. And thank God we have all the technology they need. So I was telling you before we started, for example, IVF Michigan and fertility centers, we have 9 locations across the state, and we were number 1 by the Newsweek magazine. So Newsweek come and classify every single health system in the country. We're talking about Corewell Health, University of Michigan, for all services, cardiology, orthopedics, and they rank them. Where do you stand compared nationally? So they chose our clinic number 1 in the entire Midwest, not only Michigan, Ohio, Indiana, the entire Wisconsin, the entire Midwest. We came number 1 in terms of quality of care, how we listen to our patients, but also the technology that we have. One day, if you have a minute, when we can go to, our Bloomfield, they can show you all these machines we have where you can, incubate the human embryos for 7 days and have that camera see it by minute how it's growing.
Oh, really?
And dividing. You can just look at it and see without touching the embryo, because all these cameras is able to observe it. We have 3 PhD scientists in our lab, PhD in embryology. So those are people who have doctorate degree how to create and maintain a human embryo outside the lab. We have, master's degrees. We have in embryology. So we have an amazing scientifically competent team that's able to address this. But at the same time, alhamdulillah, we have a lot of experience to be able to reach to the couple's mind and heart, to be able to say, okay, these are your options. This is how we're going to do, and earn their trust, because that's a lot of money to pay, and there's a lot of things. So to earn the trust, alhamdulillah, we're the largest by far in Michigan. So what we do at IVF Michigan in terms of number of cycles is equal to all the clinical in Michigan combined. But that means comes alhamdulillah, at a lot of resources we can deploy and a lot of technology we can invest in. A lot of patients that come to us, Jafar, they had done IVF in this clinic and they said, okay, your eggs and sperm are not good together. They cannot make embryos. Then they go to another clinic, same thing. They come to us, we say, don't worry, we have the technology. We know how to support the eggs, how to support the sperm. We know how to tell you. And they get amazed. Like I had a patient today, she went to another clinic. They will only retrieve 3 eggs from her. And she's like, I'm young, how come only 3 eggs? So I said, okay, let me do the right combination protocol, the right stimulation. She got 10 eggs today. She was fascinated. She was so happy that this is never happened to her before. So we have all these technologies that also differentiate us, from a lot of clinics, because we invest heavily in our lab, the equipment we buy, the environment where those embryos grow, makes a big difference in success.
Also, clinics might tell you that they're not compatible, but I can come to your clinic.
And
if it's the right technology, then
you may be able to achieve success. There is definitely clinic big difference. Experience, like, if you're a physician, I was in that shoes. When I was 1 year out of my fellowship, I had an experience of 3 years, 3 years training and this. But now 20 years experience, that means I've seen very complicated cases and I'm able to solve puzzles that I was not able to solve before because of the experience and the advance of knowledge and combining my experience with the science to be able to give them solutions.
Is there a case that you don't forget? Is there a case that lives in your heart?
I saw a case today that I will never forget. I told her. So she'd been trying for years and years and years, and she went to every fertility clinic in the area, and they told her there's no chance because your egg count is 0. Because her egg count on paper is 0, but she was young. She's young. She's 32. I said, I know your egg count is very low, and it's 0, but because you're young, we just need few eggs. If you give me few eggs, they're good quality. I know you're young. So we were stimulating her. She'd made 1 egg. I said, that's too little. Do you want us to cancel the cycle or would you go for it? She said, go for it, Dr. Hammoud. 1 egg. I was able to retrieve that egg, fertilize it. I said, the chance that this make an embryo is low because you need 3 eggs to make 1 embryo. So that 1 egg made an embryo and was good quality. I said, let's return it. We returned it. Today, beautiful heartbeat. They couldn't believe it. The couple had been trying for 7 years, and everybody she met, they said, it's impossible for you to be pregnant. So I said that technology in our lab was able to convert 1 egg to a baby, only 1 egg. That's fascinating. So we do have the technology, and we have these difficult cases that come to us. And we have easy cases, thank God, they get pregnant right away. But the patients don't know. Sometimes they spend their money here, they spend their money here, they spend their money. But even with us, there are cases that we cannot solve, unfortunately.
How has it changed your outlook on your own kids?
Oh, I'm going to freeze their eggs. I have twin girls. They're 17. So in my mind, when they hit 32, if they're not having babies, we're going to freeze their eggs. 1. Second, I'm very grateful, alhamdulillah, that we have kids that we didn't have to struggle about this with anyone. Third, obviously, I want them to come in this field. It's such a fascinating field. I wish I can entice one of them to be a fertility physician.
You look at them differently when you see that many people struggle to have kids. Then you can go home and your kids are, alhamdulillah, good, healthy.
10 times differently. 10 times. No matter what happened in life, I tell my wife, this is nothing compared to what I see my patients have to go through. There are also since we're talking about treatment and culture, there are some treatments that are available to our patients, but they need some kind of a twist of our culture a little bit. There could be some Islamic teachings that could be against, or Christian teaching that could be against it, for example. Or there's ikhtilaf or differences in madhab or scholars in terms of whether they're allowed or not. I'll give you an example. For example, a woman is born without an egg. So there are certain genetic condition like Turner syndrome, where a woman is born but her ovaries completely have no eggs. And, she has a uterus and they love each other. So one option is to borrow the egg from someone else. So a person will donate an egg Then so the DNA is for that other person. Then husband's sperm, and we put it in the woman, and she can create the baby. So there's some scholars out there that will allow something like that. If you have no other choice, and that's completely fine. There are some scholars don't allow something like that, and that can create some struggle for patients, like what their own belief is this acceptable or not. I have that option. Some people feel it's weird, which I understand completely because that's not new to them.
The baby would have the genetic makeup of the original egg
Of
holder.
the original genetic makeup and the dad's makeup.
Yes.
But if you go dissect that, most people have the wrong idea of what's genetic. The genetic is a code, like a book. And humanity have been copying it since Adam. Does that make sense? So in theory, we all have the same genetic makeup. Yeah. That code, with time, the copy is changed slightly. So the differences between two humans' DNA code is minimal. So that's one fact. Second, the baby copy that genetic doesn't take it. So there's no physical part of that woman or the man in the baby. There's no physical part. It's the copy. So when you look at it this way, some people say, you know what, it's science that God gave us, and we understand better what things that our parents and grandparents didn't understand before. And I'm going to use that knowledge that God gave me to be able to help myself and help my family. And there are some scholars out that way, and they're able to allow it. Okay. The same thing applies to women born without a uterus, for example. Or she had a tumor in the uterus, they had to remove it. She has her eggs. The husband have the sperm. You can fuse them together and put them in a surrogate to carry the baby for them. And when the baby is delivered, they'll come back to the woman. Some people say haram, and I respect that. And I don't try to change their mind in any shape. But the people say it's halal. So it's up to you to decide. But I don't judge other people for doing it or for not doing it as well.
Surrogate is like a woman would get...
So a woman who will carry a child for another person.
And like I always think about pregnancies as a very difficult, hard thing. So there are women that would do that.
So women will volunteer to do that, like a sister. Like I have a sister who said, I will carry for you.
Really?
She has a sister. Like she cannot ever have babies because she has a heart defect. And the minute she gets pregnant, she will die because her heart cannot maintain the blood flow to the baby. So her sister said, I will carry a baby for you. I carried 3 babies. I didn't have any trouble. So we said, all right, that's a good plan. They talked to the religious leaders. They said, it's fine with us, as long as everybody knows whose baby and there's no conflict with this, and everybody's, and all this is science, it happened in the lab. There's no human touch or anything like that.
So you're really in this field where you see miracles. And I mean, I guess a lot of people that live just ordinary lives, that maybe go to work, go to school, they don't see like these fascinating things as much as you would. And people kind of relate these fascinating things to God a lot of the times. Has it changed your relationship with God at all?
Strengthen it, but clear a lot of confusion. I mean, everything you don't know, you address to God, and that's the right thing. Because when you don't have control, it's God. But there are situations where God gave you the knowledge, and now it's not God, it's you. But we don't have all the knowledge. There's still a lot in our life to God.
Right.
But like as I said, God teaches the humans, and they say, now once I taught you, it's on you now. But when I don't teach you, it's on me. If that makes sense.
Yes.
Think about the prophet. Think about all this. Before the prophet came to teach people, God didn't judge people because this is, okay, I will judge you only with what you know. But once you know, it's on you.
Right.
Same thing for the science. So 1,000 years ago, when there's no infertility, God created that and controlled who get pregnant, not get pregnant. But when he taught us how to, this is on us now. But there's still a lot of things on him, like cancer, why affect, IVF, why 95% by the 5% of the people don't get pregnant. There's could be some, or women when they age, we don't know how to fix that in their eggs yet. One day we'll be able to fix that. There are companies right now, very active, and these older women, when they come to us, we say, we're sorry, all your eggs are, statistically, you have to do 1 harvest, 2nd harvest, 3rd harvest, they're all bad. Those companies say, I can take a skin cell and differentiate it in the lab and make a new fresh eggs, healthy,
From the skin cell.
from skin cell. It's called, induced pluripotent stem cells, IPSC. So these actually there's a company called Gameto right now. There's conducting a study at the University of Columbia. They were able to get one baby out of this technology.
Out of a skin cell.
Out of a skin cell.
Wow.
Well, the skin cells is made back to a stem cell, which is a mother cell. Then the mother, so you cannot go back in development in the skin cells to the origin. Then you restart back again and do an egg. Because all the cells in our body start from that one cell.
Single cell.
With the sperm and the egg when they fuse. So that's called a stem cell.
Yeah.
So that's like a cell that can become anything.
Okay.
So that differentiates to skin cell, eye cell. So if you can go back in time and make that skin cells go back to become a stem cell, then you can go back forward and make it whatever you want. So that's called, organ engineering. You engineer an organ, whether it's a pancreas, whether it's an eye, whether it's an ear, whether it's an egg, whether it's a sperm. My wife is a professor at the University of Michigan. Her name is Sue Hammoud. Her research field is to transform a skin cell into a sperm. And she's very close to be able to do it.
Really?
Yes, for men who are born without sperm. And they don't want to donor sperm, for example.
Do they use skin because
Skin-
we have a lot of it?
It's
Is
easy
that the
to
only reason?
access,
Okay.
or bone marrow cells, for example, another one,
Okay.
bone marrow cells.
And they
skin have
re-engineer that to a sperm cell.
to a stem cell
To a
first.
stem cell first and then a sperm.
Then she was able to create like a tissue of a testicle all in the lab from stem cells.
Mm.
So they were able to create the three-dimensional structure with, adding the right, growth factors, adding the right hormones, right temperature, the right environment. But work has been, 30 years in the make. But now we're like very close to make it a human reality.
Because that's a huge breakthrough.
It's a huge breakthrough.
That means
But
any woman can, in theory, take a skin cell, turn it into a healthy
exactly at any age.
egg.
Mm-hmm.
Wow. At any age.
At any age.
So you can maybe see women in their 60s have kids.
Right now, they can have kids with a borrowed egg from a
Okay.
young woman because the uterus.
But their
itself-
body still holds up?
Yes.
Okay.
The uterus doesn't age.
Okay.
So there's, I think, not a few years ago, a woman in India who had twin at 70 from a donor egg. So she borrowed the egg from a young person because the egg ages, not the uterus.
Yes.
You put it with a partner sperm and you put it in the 70 years old, she'll be pregnant. But it's risky for her because her heart may not, her bones may not be strong. It's not like her uterus is fine, but her blood vessels may not open up well with age and may develop hypertension. So it's risky pregnancy from a perspective of carrying the baby because your rest of your system may not work well because of the age,
Yeah.
if that makes sense.
I'd like to think about this stuff sometimes, Doc, and let me know what you think about this too. Is like naturally, before turning skin to stem to egg, menopause is a thing where, okay, after this age.
Because the eggs are gone, are all bad.
Yes.
They're all dead. That's why menopause happens.
Right.
So all the eggs are dead. Okay, now there's menopause.
I want to imagine that there's a reason that we were created like this. So that's
The reason first, we didn't have the knowledge how to take care of ourselves.
Mm.
Okay, so when you're created, you don't have the knowledge. So when you don't have the knowledge, you cannot have 70-year-old get a baby and they die because their heart is weak or their bones and things like that. But when you do have the knowledge to be able to help also the heart and make the person healthier, so we are able to push these boundaries because the knowledge is given by God. The first thing that God said to Sayyidina Muhammad is what? Iqra.
Iqra.
That's Iqra. Read.
Yeah.
And I give you the knowledge so you can be Khalifa al-Ard, to be able to control the land I put you on. You're not going to be able to control it unless you learn. And when you learn, I give you the Khilafah. Now you're my Khalifa. You're my deputy. Now you do stuff. It's like your child. When do you allow them to drive?
When you teach them how to drive.
When you teach them and they become knowledgeable, okay, now you're responsible of driving a car. When can you marry? When can you, as a physician right now, when can I do a surgery on someone? Even if I'm the smartest person on earth, I need training. Training, now you're responsible. You can do this. And the same thing, humanity. God, okay, train you, give you that knowledge slowly with time. Then, okay, now you can control this part of creation. But there's other parts that are deeper, that's way thousands of years away from us. Like you feel that this is the end of the science, but this is the beginning of a huge journey, and that we don't understand yet.
It would be a massive breakthrough if somehow
Yes and no,
you can
but
get two skin
you'll
cells.
see that, like, compared to like the breakthrough that's going to be 500 years from now,
Yeah.
or 1,000 years from now. They will look at us like, oh my God, those people were so behind. They were struggling to make a sperm in a dish, or they were struggling to make a human live 100 years old.
For those of you who know me, know how much I love Palestine drinks, and the reason I love them is we didn't have an alternative to mainstream soda. We only got what we consumed in stores, what was available in stores, and then they introduced a high quality product that tastes great, and the cause behind it is fantastic because 100% of the proceeds of this company go straight to the people in Palestine. So there's just a lot to love when it comes to this brand. And now they're releasing their new orange flavor, and it's going to be available very soon in stores near you. In every store that you find Palestine drinks in, you're going to start seeing the orange flavor very soon. And to be honest, this might be their best flavor yet. So make sure you grab a case wherever you see it. And now, back to the episode. I'm imagining two skin cells that eventually make a human being. One from the man, one from the woman. And then this turns into an egg, this turns into a sperm, fertilized. And potentially, in theory, you can get a human being from two skin cells.
In theory, yes.
Mm.
And they did it in the mouse.
Oh, it worked in the mouse?
They took two male mice.
Okay.
One produced a sperm and one produced an egg.
Okay.
They're both males. And they were able to put them together and created the pup.
Wow.
So the idea, you cannot stop science. You just have to you have to advance your thinking process.
Why didn't they take it from the woman, from the girl, or female? I'm sorry.
So to create a male, you need a Y chromosome.
Right.
Women don't have the Y. Women have X and X.
Mm-hmm.
And the men have a Y and an X. So you can take that X and make it two X's and become a woman.
Mm-hmm.
But you cannot take a woman and make it a male, because it doesn't have a Y.
Okay.
So have an X and an X.
So why don't they take the two X's, break it, one X and one Y, and put them together?
There's no Y in the women.
Oh,
Doesn't
so
make
was it
sense?
from the same man? From the same male?
No, not different. But males have Ys.
Mm.
So you need a male, if that makes sense.
Yeah. Oh, okay.
So-
Because...
So let's say, okay, you have two women.
Mhm.
You don't have a Y. You cannot create a male from them.
Correct.
But a male, you can create a woman from it, and that's interesting because the mythology, the Islamic mythology, بتقول لك إنه Adam Hawa was created from a dula, from Adam, so the woman was created from the man,
Mm-hmm.
and science support that, because men have X and a Y, so the X can be multiplied, and you can get a woman out of it.
Okay.
But the woman can never create a male,
Yeah.
to at least according to science right now.
Mm.
Because you cannot have a Y chromosome in it.
Yeah. When do you know when it's time to tell the couple that stop trying? This is not going to work.
We rarely do that.
Rarely.
We rarely do that. We tell them your next step is this. And that's
Okay.
where they choose whether to take that next step or not.
Okay.
So sometimes we have these hard conversation. Okay, we tried with your eggs. Your eggs, unfortunately at this age, don't have enough energy in them, and they don't have the genetic material. So if you want to find one good egg, you may have to harvest 10 times, and that's not possible.
It's not possible.
You need to borrow an egg.
Mm.
Where that conversation go, them couples say, no, we stop here, this is not for us. And that's okay. Some couples, say, no, that's, I'm going to ask my scholar, and if they're fine with me, I'm going to take that next step and be pregnant.
How do you help people grieve a kid that was never born?
That's hard. That's hard. That's a true problem that a lot of patients have. Whether a child is never born or a miscarriage, for example, a child was almost here. And most people think, oh yeah, try again, don't worry about it, or it's not a big deal, you get pregnant again. I think the first thing you need to is acknowledge their grief and say this is true, and you have the right to grieve that. A grief a child that is not born yet, or a child that miscarried. So give them room and give them, I think, validation of their feeling. So that's important. But at the same time, tell them that this is part of life, and it's why it happens, why it can happen, how can we prevent it again from the future, and what's the solution, and get out of it. I mean, we have some tools that we can use, but also we have some professional tools. For example, we have a lot of counseling services that work with us. So we have reproductive counselors that specialize in this, because some of our patients get to a point where they're worried about fearing PTSD, like what if I got pregnant again and miscarry? What if I did IVF and fail again? I have these fears of what's going to happen. And obviously being a physician with experience, I can do the basic counseling, but when it comes to couples needing true counseling, we refer them to reproductive counselors, and we have amazing teams that we work with, that they're something maybe lacking in our community is a counselor that understand the culture better. So if there's out there somebody hearing us who's a counselor or psychologist who have an interest in reproductive medicine, I'm happy to talk to them, and they can come with me and can develop these knowledge of what are the, like you said, these barriers, the intercouple conflict sometimes that come, the mourning a child that is not here, or a miscarriage, or a lost opportunity with IVF. You pay all this money and you transfer and you don't get pregnant, for example. That's a huge, and be able to help couples through that will be an amazing resource if we can develop it.
I can imagine there would be a lot of resentment. For example, just based on this conversation, you said that there's a lot of couples that, for example, would wait 7 years and then they'll do IVF. And let's say, for example, because you said the woman usually is more wants it more, and she's like, yeah, let's go do it. Maybe after 7 years it doesn't work, and through them understanding the process and you telling them that if you had started maybe a couple years back it would have been better, then there's going to be resentment between the man and the woman.
I almost always don't say that word, because there's no point in it.
Yeah.
Does that make sense?
Yeah.
Like if you have a couple right now in front of you, I don't think it's helpful for me or it's helpful for them to say, if you have started 5 years ago, would have been better.
So that would build resentment, probably.
Resentment is not helpful to anyone.
Right.
This is an observation that's not helpful.
You're very aware of
What
this
I
stuff.
do, absolutely. What I do is different. Or I do when I see them young, I say, do not delay it, because there's a chance for them to act on it. But after the fact, there's no point to say, I wish we came, because in my mind, nobody's delaying it on purpose. They're either delaying it because they didn't know, or they delayed it because they didn't have the money to do it, or they delayed it because someone told them IVF babies become defective, or they come with autism. All these are myths out there. There's unfortunately some of that out there. Like there's birth defect.
I wanted to ask you if there's a chance.
There's a chance of birth defect, but no higher than any other baby born naturally.
Okay.
But so there's people like fear it is artificial. What does that mean? Is the baby is going to be fine? Some people don't have that information. Like they don't understand. Like you said, they go to their life. They work in mechanics. They're the best mechanics in the world. Like you trust them, or the best. They're the best chef. They make you the best meal in the world. But they don't know what I do.
Mm-hmm.
Like I don't know what they do. I respect their knowledge, like they respect my knowledge. But they're not in the field. They don't understand what is this. So they fear. So these things. So everybody that come to my office, they delayed it for a valid reason. So I'm not going to sit down and blame them why you did it, because I know they did it because of one reason that out of their control, because nobody wants to hurt themselves at the end of the day.
Right. What are some of the main myths that bother you when you hear people talk about?
So myth is like, for example, somebody stressed about fertility. Somebody say, don't stress about it and it will happen. for example. How can you not stress about it if it's not happening? As if stress something, you can switch yourself and say, okay, today I'm not going to stress about me not having babies for 5 years. You cannot not stress about it. So that's one. Second, stress doesn't cause infertility. So whether you're stressed or not, it's a biology. It has nothing to do with your stress level.
Yeah.
So there's a lot of misinformation. People trying to help, like say, don't stress about it, and it will happen. Instead of saying, I heard of this doctor, he's good, or,
Why
that's
does
a
that bother you?
resource. Because it delays, because it put the patients as if they're causing their own fertility. Because, somebody, like when patients say, oh, they told me not to stress about it. Well, how can I not stress about it? And we should stress about it. She thinks she's doing something bad, and that's why she's not getting infertile, because she's stressing. So there's a lot of, like, she self-blame, like, they're telling me not to stress, and I'm not able not to stress. Maybe I'm like weak, or I am to blame. So it bothers me because my patient's suffering with the self-blame. Does that make sense? Yeah. So that's one of things, for example, one example of things. Second is, people sometimes are just, they prioritize hope over science. Like they say, okay, maybe we'll fall into that 1% or 2% and not take action sometimes, especially if they're capable, to help themselves to get pregnant.
Have you met a baby that you've...
All the time. You go to my Instagram, Dr. Hammoud IVF.
I mean, as they're like older.
Oh, not old enough.
Not old enough to
I can tell you a
understand?
story. I can tell you a nice story.
Yeah.
So IVF Michigan started almost 30 years ago. Before I joined only 2014. So I've been here for 10 years with them. But started in a clinic in Saginaw.
Okay.
In Saginaw. Dr. Michael Fakir did the first twin IVF in the state of Michigan. So, and it was like on the newspaper.
Wait, twins, that means 2 sperm?
No, so that means 2 seeds, 2 embryos.
Okay.
So they fertilize first egg, second egg, third egg, fourth egg. 2 of those fertilized eggs make seeds called the embryos.
Okay.
So they put the sperm in each one of those eggs, separate eggs, fertilize, then put those 2 eggs together in the women.
Was it an experiment, or was that per request?
In the past, they didn't know which embryo will make a baby. So 30 years ago, we didn't have the technology to test them genetically. So they used to put 2 or 3 or 4 at a time in the hope of one stick. But now, obviously, we can test and know which one will stick. So we do 1 at a time. But in the past, they didn't do. So they put 2. So this resulted in a twin. And one of the babies, so the twins that was made at IVF Michigan 30 years ago, came to me. And she had infertility herself. So I did IVF on her and put 1 embryo and split to 2. So she got twins herself.
Oh,
so
wow.
she's a twin of IVF from IVF Michigan, and she got IVF herself.
And she got a twin?
She got a twin.
Wow.
So it's a circle. I mean, I'm still at an age where I don't know if the babies, so I've been on this 20 years, so, the babies that I made are 20 years old.
Right.
Maybe I will start seeing some of them.
Yeah.
Maybe. But also I started in Utah, so in Michigan, the babies that I made are 10 years old.
Okay. Yeah, that makes a lot of sense. That makes a lot of sense. What's the hardest conversations that you've ever had with a patient?
So some of these conversations when the odds are low, or these are very hard, for example, or when you want to use a non-traditional, or when you need to make a major shift. But also I find it hard when I know that a treatment can help my patients, but they cannot afford it. I cannot live with this. Like, I go home and I talk to my wife and I say, I don't know what the solution for that. Like, I wish I can give them free treatment, but it's so costly to run an IVF lab and create an embryo outside. And the people, I tell everyone, like, an IVF cycle, whether it's a retrieval or transfer, is like 15 people working together, from the nurses, the front desk, the doctors, anesthesiologists, the lab technician, the PhDs, the spaces. It's a whole production.
Right.
Then you come and you say, okay, those couples, I can help them. I have the technology, I have the knowledge, but they don't have the money and I don't have the resources. We have this great resource that give you a 50%, but that's not enough for some couples, and they don't know how to help themselves. And that's a very hard conversation to say to someone, yes, I know how to help you, but you cannot afford it for whatever reason. And some people cannot afford it. They're young, or they just came recently to the country. They don't have the financial resources. They have financial obligations. They have children. They have all kind of reasons not to be able to afford it. So these are very hard conversations for me when it comes to like, Dr. Hammoud, I cannot afford it. They say that word and I'm like, oh my God, this is paralysis for me. What can I say?
It's difficult to follow up on that.
Very difficult. Like, I cannot afford the Dr. Hammoud. Give me something else. But that's the only thing they're going to get you pregnant.
Yeah.
What else? Then I'm going to say, okay, try this other treatment, but it's not going to be as effective. Then they know and I know this is not the right path, but we cannot fix it. But thank God the way insurance are like I told you, like 10 years ago, 5% of the insurance covered. Now 50% of the insurance are covering. But the path is going, and the president has just signed an executive order to look at all the United States agency to see how they can make IVF affordable.
I saw that.
So that means that maybe we'll have more coverage, coming our way.
How do you think AI is going to help make your process more efficient? I'm just so curious about that.
I mean, AI is going to be everywhere in our life. I don't know if you're reading about, I'm sure you are, in every single field. For example, coding, you don't even need like basic coders anymore. You can, yesterday I was reading that Google Gemini Pro, you can go there and sketch an app. You can put a square, and these are the buttons, and this is the screen where I want the app to do and all that. Just sketch it, and Gemini will give you the code. Just code the whole app for you.
Right.
So this is a field that's going to infiltrate everything. Like for us, is going to help us make the better diagnosis. You input all this information. It's going to see trends that human brain cannot see. When you're a doctor and you observe 10,000 patients, if there's a trend only in few patients, you're not going to be able to detect that.
Right.
We detect maybe if it's 100 or 200 patients, but AI is able to detect these small trends and small tweaks to make that success better and better and better. Choosing the embryo in the lab, there's a lot of AI.
That's what I was wondering about.
Yep. So softwares that can look at these embryos and see, okay, which embryo, they divide this millions of cells division and be able to choose the embryos. They build robots right now that controlled partially by AI. They can do the fertilization process automatically, not by human. Like where the egg and putting the sperm in it, robots are able to do it, and they had amazing success rate. They just published a paper on that. So it's gonna obviously affect every single aspect of what we do, make us better, make us more efficient, make us able to help more patients in a smaller amount of time.
Hopefully make it cost effective too.
Make it cost effective, teach us ways of like not needing to do this elaborate systems in the lab, maybe we're able to do it in a more cost effective way.
Yeah, I mean, I know we didn't go into the details of like how you simulate the eggs, but because everything you're explaining is super detailed and there's a lot of percentages that go with it. So I'm thinking that AI could, like you said, catch those trends, make it easier. This is the egg that's going to be...
IVF is ripe for AI to come and understand the patterns and streamline it better.
But it's completely safe. Like the baby, there is no extra threat on the baby's life if it's an IVF baby or not.
So if you look at it from a perspective, like if those couples with infertility got pregnant on their own versus through IVF, no difference in risk.
Okay.
But couples who have infertility who get pregnant on their own naturally have a higher percentage of birth defect than couples without infertility of 1%.
1%?
1%.
Okay.
So that's so any IVF baby has almost a 1% higher than babies born naturally to couples who have no infertility, but not to couples who have infertility who got pregnant on their own. So the minute you have infertility, you have that 1% risk, whether you did naturally or you got pregnant with IVF or not. So that's one level. Second level, there are some aspects of IVF. There's slightly higher rate of birth defect, but not due to the IVF itself. For example, we have cases where men come to us with no sperm. And we do every treatment and there's no sperm. So we decide to go and fish for the sperm in the testicles. So we put them to sleep and we open the testicles and fish for hours for tiny, tiny small sperm. So a procedure called microtesty. We found the sperm, but it's like deformed and half the head is formed. Okay, we put it on the side. Oh, another sperm, until we count like 10 sperm.
You fish for...
Fish for hours and hours with the testicles. Once we open it like this, then we start fishing for the testicles, called microtesty. But they have no other option. They have very, very low sperm count.
People do that?
People do that, absolutely.
Wow.
They do that. So now these sperms are deformed. What are the choices? Like you're starting from a bad sperm. So there's going to be an uptick of some birth defect. But the risk is low, like up by 2%, not 50%, for example. But those cases, it's a trade-off. Like, would you accept that risk versus not having children? Everybody's different.
I mean, you're saying there's zero sperm, so any sperm is better than zero sperm.
But there's a slightly higher rate of birth defect, for example, in these procedures. Slightly.
But it's not about the IVF. It's the sperm quality
it's
is
the sperm
bad.
quality. That's exactly it.
Yeah. Wow. Like, I feel like we can talk about this for hours. It's such a fascinating subject. But we'll definitely set something like a follow-up to this. Like, I really, really want to.
I would love to.
And it's good to get feedback also. So we'll see how people react to this. But man, like, you blew my mind. I'm not joking. Like, this was awesome.
Thank you. Absolutely. I would love to talk more when you have the chance.
Thank you, doctor.
Thank you. Have a great day.